Hi, everybody. Thank you for joining us. I'm so excited to be here today for another recording for Cheers for Charity New Hampshire with my great friend JoAnn Burchuk. Hi, JoAnn. Nice to see you.
Hi, Lisa. Thanks for starting us out here. I'm JoAnn with Lighthouse Physical Therapy, and it's my pleasure today to introduce Rebecca with Seacoast Mental Health. And we all know how much everybody needs a little help these days going on. So it'll be really interesting to hear the services that you offer. So Rebecca, welcome, and please share with us about what your organization does.
Thank you. I really appreciate you both of you having me on. Seacoast Mental Health Center is one of the 10 community mental health centers in the state of New Hampshire. Our state is really unique in the New England area that we have state mandated community mental health centers. Seacoast Mental Health Center services 24 towns in the eastern half of Rockingham County. And we service and care for individuals and their families, regardless of their ability to pay. So we have people on Medicaid, we have uninsured, and we have private insurance clients. And their age is essentially 3 years all the way through elderly age. We offer everything from traditional therapy as you would think it for children, adults, and the elderly. We have a substance use disorder program which includes some group counseling and medical assisted treatment therapy. And we have a variety of services essentially for people with more severe mental health and also who essentially need life support structures. So we help people with job placement, with interviewing skills. We help them with fitness programs. We help them get on state services. We have a whole case management area that will help people stabilize essentially their whole life, because mental health is more than just what's going on in your mind. It's everything that's going on in your world. For children in particular, we end up working with kids on a lot of trauma-based programs. We have a variety of experts that specialize in youth trauma. We have an ADHD and also an autism specific program. For the elderly, we manage a state program, which is called REAP. And our counselors out of Seacoast Mental Health Center manage the managers all throughout the state. And these are essentially case managers that work with people 65 years and older who either can't get out of their home, who are facing isolation, a lot of them have housing crises. We deal with a lot of homelessness issues for the elderly and all ages. And so this is a really vulnerable population that we deal with out of our center and help manage through the state. Up and down the Seacoast, we have also another part that we service is we do have a large population of people experiencing homelessness. And so we have case managers that are out in the field. These are primarily 20-year-old to 29-year-old amazing caseworkers that are out in the streets working with individuals in our communities. Every community we serve in the eastern half of Rockingham County has a fairly significant population experiencing homelessness. So the way that I think about what we do is that if you think about someone's life or someone's family's life, if any piece of it tips, it's a piece that we can help with. And essentially anybody who's in our community has access to and qualifies for our services.
That's amazing. I had no idea you guys were out there and that you offered so many different services for everybody. It's amazing. Now, one thing I know you guys are working in the individual schools now, and obviously that's kind of all over the place with whether kids are going to be in school or out of school. How are you going to be handling that sort of situation for the school age kids?
So one of the amazing things that happened when the COVID crisis hit in March is we moved prior to Governor Sununu signing Executive Order 8, which is when telehealth and a lot of the HIPAA privacy laws across the state essentially were loosened. We had already moved our therapists out of the office. We took a risk and basically said, our mission is to provide direct access and wide access to high quality, effective care to anyone who needs it in our area. And so our CEO had made the decision right before the stay-at-home started that no matter what, even if we didn't get paid, we would provide care. So we moved everyone home, and our therapists, who you're correct, are in the schools. We staff the therapists that are in the schools in every district in New Hampshire that a community mental health center serves are staffed and supported by the community mental health centers. So it provides an amazing point of contact for children who then don't need to leave to go get their services. There's not a stigma around it. They go see, you know, friendly Jane in the school. They don't have to actually get in a car and leave and go see their therapist. We have seen kids all throughout this time. And in fact, June 1st is our youth therapy workers, who are our school workers, were the first ones that we let back out in the field. And they started seeing kids June 1st because the children were so desperate to get face-to-face with someone. We all thought that the population that would adopt telehealth the best would be the kids, and it's not. The kids want contact. They need to see someone. They're often in a home situation where they're not comfortable talking about their problems because maybe the problem is in the next room. Maybe they just don't want them to hear. They still have that privacy level. And we had a lot of requests to get in front of kids. And so we have these amazing therapists that work with these children. And it's kids of all, again, it's kids in crisis, and it's kids not in crisis. It's just kids that need extra support. So we are still there. Our Director of Children and Family Services has been working very closely with all the school districts in our region on their school opening plans and how we will help support staff them. This has been happening across the state, so the other mental health centers have been also doing this to different degrees with their school districts. So parents, the one message for parents is that help is still there. All they need to do is contact the school administrators if they had not accessed services before. And they still have access to, if they're in our area, to our therapists. You know, if the school is remote, we work then with the parents to figure out how it is they're going to meet. We're seeing people back in the office now. So, you know, under the protected COVID guidelines, we have a certain amount of people we can bring in. Summertime makes it really great. We have people who are at picnic tables outside doing therapy, you know, and we still fit all the HIPAA laws. So we can see the kids, and we'll be able to continue to see the kids.
Yeah, that's awesome. I'm just blown away at, you know, how many people your organization is able to help right now. What are you finding, I guess, in the mental health? What are you seeing the most right now that really is maybe concerning, or, you know, people should be looking at?
So I'm not a clinician. I'm the VP of Community Relations. So I'm not in front of clients, but I read all of our data every single day, and I read the state data. The one nice thing about being part of, all the community mental health centers are part of an association called the New Hampshire Behavioral Health Association. So I have my 9 counterparts across the state, as do all the clinical teams. So we share all this data all the time, which is wonderful. I would say that one of the biggest issues we're seeing, and we're seeing it from kids all the way, especially into the elderly, is the isolation. You know, screens are great, and being able to do what we're doing is fantastic, and it's not the same. And the longer things go on, you know, some people can adapt really well to this kind of communication. Some people can't. It has actually helped some of our areas of care, like substance use disorders. It's removed certain barriers, like people who can't drive, or some people are more comfortable in their own home, having different supports around them and sharing. And other people, either they don't have the technology. You know, we're seeing equity issues with access to technology throughout the state, which is a problem. The isolation that people feel as this goes on, we're seeing things that worked really well. You know, now it's, I just need to see you. I have to physically see you, you know, and we can only see so many people so quickly, physically. I think what's wonderful, and our staff is, I'm going to tout our staff for a minute. We have about 220 staff between, we have offices in Portsmouth and Exeter. Like I said, we co-locate in the schools. We co-locate in Core and Appledore some physician offices. And actually we have an emergency services arm, which is 24/7. If anyone calls either of the phone numbers on our website, they have access to emergency care 24/7. And we also, our emergency team staffs within the emergency department in Exeter Hospital. So if somebody goes in there in crisis, we're the ones actually that see them.
Yeah.
And our staff, everyone has fear around kind of getting back to normal. And our staff has moved as fast as they possibly can. I've seen some of these people really set aside their own concerns because they are so dedicated to the people that we serve. You know, it's the stories that I get from them are just, it makes my job super easy because it really matters to them, and they're seeing their clients. You know, my clients need to see me and I need to get in front of them. So I would definitely put that isolation piece. I think obviously if people have more of a serious diagnosis, anxiety, depression, you know, certain schizophrenia sides, we're seeing, you know, this kind of level of stress that everybody is under has become much harder for pockets of that population. But what we're also seeing is what we call the walking well, which is, you know, the average person that needs therapy. We're the population that's tipping. And people who never thought they needed therapy or who have a stigma in their mind about therapy, that's those people, and who are suddenly like, I don't even know how to handle this. We are getting many more of those calls. And that's a really good thing that people are starting to raise their hand.
Yeah, it really is. I mean, it's not until people realize that they're in trouble and then start seeking out help that they can get to the other side of it. So that's fantastic. Now, you guys you're a nonprofit, but you're mandated by the state. So how does your funding work as far as that is?
Yeah, so we are a nonprofit. We are and the 10 centers, we're all in different places. We're all different sizes. We are mandated to do the same things, but we all also have our own idiosyncrasies. And obviously our service areas are really different. You know, what we have to cover in our part of the Seacoast is completely different than what my counterparts up in North Country do, which they cover like a third of the state, you know, and they have 15 offices that they're trying to coordinate everything in. So we have funding from obviously the state budget, a certain amount. We are a fee for service to a degree. So we bill Medicare, we bill Medicaid, we do bill private insurance. You know, we have a lot of people that come to us from Newcastle and certain parts of Portsmouth and Rye, and, you know, that are coming in with their Blue Cross Blue Shield anthem. We do grants. Part of my team is grant writing and fundraising. She's excellent. And so, you know, we go after sort of programmatic grants, and also, you know, grants like the New Hampshire Charitable Foundation, you know, does sort of system-wide, organizationally focused, mission-driven grants. So we go after them. We have frequently used grants for essentially areas where we see a specific kind of service that isn't billable, because we do a ton of non-billable services. Most of what we call community and life supports, which are things like helping people find the jobs and physical fitness, the case management side of things, the life stabilization things. We can't bill for that. Right. So I think that therapy we can bill and we get state monies for, but those things we can't. So that's where we have to do a lot of creative work. You know, things around our kids that we serve, they end up needing, we do a summer camp usually in the summer. Right now we're doing virtual camp. And teeny outdoor little camps. And we also put together, like lots of places did, we put together camp support bags. You know, all those items, either we pay for ourselves or we get donations for. I have a grant partnership right now with the New Hampshire Theater Project out of Portsmouth, which is a wonderful group. And they are probably going to be doing some one-on-one work with some of our clients who are interested in this. And these are some of our clients that sort of have some more severe diagnoses and are also incredibly creative, fabulous human beings that are going to get together and hopefully be able to write some pieces about their life or their experience or whatever they come up with. And that kind of creative work, or an artist program, we have grants that support that. So I would say I'm only charged with raising about 2 to 5% of our budget a year. That said, we're about a $20 million organization. So, you know, it is a chunk that we're charged to raise. But, you know, we find the way. The state has been, I will say, throughout this crisis, the state has been fantastic. You know, it's not going to be an ever-ending pool of money falling from the sky, but the state has definitely stepped up to help organizations like ours and others get through this.
Awesome.
That's fantastic. Rebecca, can you just share with me too, when you say our area, what's sort of the map? You know, what areas do you guys cover?
Okay.
Yeah,
I'm going to do generally because I know that on this one, we have a very weird, we almost have like a backwards boot. Okay. So we start in Portsmouth and we go all the way down to Seabrook. That's easy. We cut across like over Exeter. We do cover Newmarket, so it cuts down in Exeter, and then we go over essentially to Epping and Fremont, Deerfield, Nottingham, Northwood. So it kind of swaths up. So it's 24 communities. And I mean, our own service area is very, very different one end to the other. You know, I'm consciously trying to figure out partnership programming with other little nonprofits. That's kind of my thing. That's my sweet spot that's worked really well in the past year for us for awareness. And, you know, remembering that people who are in Fremont they don't always have the same needs or the same supports around them that people over in Exeter do, or Portsmouth, because I mean, the public transit is terrible all around the Seacoast, but there's at least a tiny bit with the coast transportation route over on the real Seacoast, and there's nothing over in Raymond and Deerfield and Fremont. So we have to try and think through all these aspects for our clients.
Fascinating.
So it's an amazing world that I started a year ago, and I've been in this general industry for a long time, but not in New Hampshire. And I didn't realize this incredible structure that we have in the state, and how all 10 organizations truly need their community support, because we aren't funded entirely by the state. And there's a lot more we could do. Particularly, like I mentioned, transportation, that's always an access to care issue for people. There are a lot more things that all these groups could do, but it is an incredible resource for the citizens of New Hampshire.
Wow, I'm so grateful that this group exists. I think it's really fascinating. If people want to learn more about, you know, the programming, the things that are available, the areas that you cover, what's the best way for them to get more information?
Well, like everybody, they can go to our website, which is smhc-nh.org. We also have really active social media. So we're on Facebook, Instagram, Twitter, LinkedIn, and we have a YouTube channel. One thing COVID has brought out is that our staff really like to make videos when I ask them to make content-oriented videos, which has been awesome. So, and they're just these incredible experts that I get blown away every time I listen to them for 5 minutes, because it's such a talent I don't have. So those I would say would be the two ways.
And if people have need for services, pick up the phone and call, and you guys will. And if you guys don't do it, you can probably find them someone who can.
Yes. In fact, we frequently get people who call out of our catchment area. We will refer them to one of our sister organizations. We always have people that come into the emergency room, obviously in Exeter. We will never turn someone away who's in crisis. That is one of the things. If someone walks into our door in crisis, no matter where they live, we will get them stabilized and get them where they need. But we'll always direct someone to the right place.
Fantastic. That's great. JoAnn, any other more questions? I know Rebecca's given us so much.
I know this has been really interesting. Like I said, I was not aware of the extent of all the programs that you guys do. So we are so appreciative for all of the work that you guys do and, you know, help the people in our community. It's fantastic. Thank
Yeah.
you.
Appreciate the
Great.
time,
Today.
both of you.
Thank you. Yeah, no, we love this. We loved hearing about Seacoast Mental Health and how you guys are a resource, especially now more than ever. I think people are talking a little bit about, you know, wow, there's a lot going on in our world and in our heads, right?
Yeah.
And there's now resources to support that. So that's fantastic. And it's always a pleasure to talk to you, Rebecca. I always love it. So thank you so
JoAnn.
much. Thank you for being here, and we look forward to talking to you again soon.
I hope so. Thank you.
And I'm sorry, your name was?